Have you ever walked into a room and forgotten why you're there? Or struggled to find the right word in a conversation? Perhaps you've noticed your thoughts feel a little less clear, or it's harder to focus on tasks than it used to be, especially after you've passed the age of 50. That fuzzy, muddled feeling, often called brain fog, is incredibly common. It can be frustrating, inconvenient, and sometimes, frankly, a little worrying. While occasional brain fog can certainly be a normal part of life, perhaps due to a sleepless night, stress, or a busy schedule, sometimes it can be a subtle whisper or even a louder signal that something more significant is going on with your health. But how do you tell the difference between normal age-related changes and something that truly warrants a closer look? It's a question many of us quietly ask ourselves. Today, with a gentle, caring, and expert approach, I want to guide you through this important topic. We'll reveal 5 crucial signs to watch for that might indicate your brain fog is a symptom of something more serious, something that needs professional attention. We'll explore what to look for, why these signs matter, and, most importantly, empower you with the knowledge to take proactive steps for your cognitive health. Please, don't dismiss your brain fog without understanding these key indicators. Understanding brain fog. First, let's clarify what brain fog usually feels like. It's not a medical diagnosis itself, but a collection of symptoms you might experience. Difficulty concentrating or focusing. Problems with memory, like forgetting names, appointments, or where you put things. Feeling mentally slow or sluggish. Trouble finding the right words, word-finding difficulties. Feeling confused or disoriented. While it's common, especially as we age, it's essential to know when it could be pointing to an underlying issue. Here are 5 things to watch for. Sign 1. Persistent and worsening symptoms. One of the biggest indicators that your brain fog might be more than just a temporary inconvenience is its persistence and whether it's getting worse over time. What to watch for is your brain fog constant rather than just occasional. Does it seem to be gradually or even rapidly intensifying? Are you noticing new cognitive difficulties appearing or old ones becoming more frequent and severe? Normal, occasional brain fog tends to come and go, often linked to clear causes like fatigue or stress. Persistent, escalating fog warrants attention. Why it matters. This pattern can sometimes be an early indicator of neurodegenerative conditions or chronic underlying health issues that are silently impacting your brain. Early detection is key for managing these conditions. Story. Our friend, Helen, 68, initially dismissed her brain fog as just getting older. She'd forget appointments more often and sometimes struggled to follow conversations. But then it became daily. She'd get lost driving familiar routes, and her family noticed she was repeating stories frequently. It wasn't just forgetting a name anymore, Helen shared. It felt like my brain was always wading through mud, and it was getting thicker. This persistence and worsening prompted her to see her doctor, who then began a thorough investigation, eventually leading to a diagnosis that allowed for appropriate management and support. Sign 2. Accompanying physical symptoms. Brain fog rarely travels alone when it's a sign of something deeper. Pay attention if it's accompanied by other physical symptoms. What to watch for. Are you also experiencing unexplained fatigue, significant changes in weight, gain or loss, hair loss, feeling unusually cold or hot, joint pain, digestive issues, or changes in mood like persistent sadness or irritability? These could be clues. Why it matters. Brain fog can be a symptom of various underlying medical conditions that affect the entire body. For instance, thyroid dysfunction, both underactive and overactive, vitamin B12 deficiency, anemia, autoimmune diseases, and even chronic infections can manifest as brain fog alongside other physical signs. Treating the underlying condition often resolves the cognitive symptoms. Story. John, 74, felt increasingly off. Besides brain fog, he was always tired, gaining weight despite not eating more, and felt a constant chill. He just put it down to age. His daughter, concerned by his fatigue, encouraged him to get a full checkup. His doctor found his thyroid was severely underactive. Once he started thyroid hormone replacement, John was astonished. "It was like a heavy blanket lifted from my brain," he exclaimed. "The fog cleared, my energy returned, and I felt like myself again. I had no idea my thyroid could do that to my mind." Sign 3. Significant impact on daily life and function. Occasional brain fog might be annoying, but if it's genuinely interfering with your daily life, it's a red flag. What to watch for? Are you struggling with tasks you used to handle easily? Are you making more errors at work or in hobbies? Is it affecting your ability to manage finances, follow instructions, drive safely, or maintain your home? Are you withdrawing from social activities because of embarrassment or difficulty keeping up with conversations? Why it matters. When cognitive changes start to impact your independence or ability to participate in daily activities, it moves beyond typical brain fog and could indicate a level of cognitive impairment that needs professional assessment. Story: Robert, 70, had always been meticulous with his finances. Lately, he found himself struggling to pay bills on time, making errors in calculations and forgetting important deadlines. He started to feel overwhelmed and anxious, withdrawing from his volunteer work because he couldn't keep track of details. "It wasn't just a mild forgetfulness," Robert described. "It was truly affecting my ability to manage my life. I knew then I needed help." His family doctor recommended a cognitive assessment, which led to a diagnosis of mild cognitive impairment, allowing them to implement strategies and support early on. Sign 4. Sudden onset or rapid progression. While gradual changes over years might be normal aging, a sudden onset or rapid worsening of brain fog is always a concern. What to watch for? Did your brain fog appear suddenly over days or weeks, rather than gradually over months or years? Has it progressed rapidly from mild to severe in a short period? Why it matters. A sudden or rapid change in cognitive function can signal acute medical issues like an infection, e.g., a urinary tract infection in older adults, which can cause delirium, a medication side effect, especially with new medications or changes in dosage, a stroke, a head injury, or even dehydration. These require immediate medical attention. Story: Carol, 76, woke up one morning feeling incredibly confused and disoriented. She couldn't remember what day it was, struggled to recognize her own kitchen, and felt a profound mental fogginess that wasn't there the day before. Her daughter, noticing the sudden and dramatic change, immediately took her to the emergency room. It turned out Carol had a severe, silent urinary tract infection, UTI, which is a common cause of acute confusion in seniors. With antibiotics, her brain fog lifted completely within days. "It was terrifying how quickly my mind changed," Carol recalled. "I'm so glad my daughter acted fast." Sign 5. Significant sleep disturbances. While occasional poor sleep can cause temporary fog, chronic, severe sleep disturbances linked to brain fog can be a sign of specific underlying issues. What to watch for? Are you experiencing severe insomnia, waking up frequently, or feeling extremely tired even after a full night's sleep? Does your partner report heavy snoring or gasping during sleep? This persistent sleep issue, combined with brain fog, can be a major red flag. Why it matters. Conditions like sleep apnea, where breathing repeatedly stops and starts during sleep, can severely deprive your brain of oxygen, leading to significant cognitive impairment and brain fog. Chronic insomnia also impacts memory consolidation and brain health. These conditions are treatable, and addressing them can dramatically improve cognitive function. Story: Frank, 79, had been struggling with brain fog for months. He constantly felt tired, but couldn't understand why, as he was in bed for 8 hours a night. His wife mentioned his incredibly loud snoring and occasional gasping for air. Frank's doctor suspected sleep apnea and referred him for a sleep study. The diagnosis confirmed severe sleep apnea. Once Frank started using a CPAP machine at night, the change was remarkable. "It was like someone finally turned on the lights in my brain," Frank exclaimed. "The fog lifted completely, and I felt energized. I had no idea my sleep issues were literally suffocating my brain." Conclusion. So, there you have it. 5 crucial signs to watch for that might indicate your brain fog is more than just a typical sign of aging. It could be a whisper from your body or brain needing attention. We've discussed persistent and worsening symptoms, the presence of accompanying physical symptoms, a significant impact on daily life and function, sudden onset or rapid progression, and severe sleep disturbances. Remember, while some brain fog is common, dismissing these key signs could mean missing an opportunity for early diagnosis and intervention for a treatable condition. Your brain health is precious, and empowering yourself with knowledge is the first step towards safeguarding it. If you recognize any of these persistent or concerning signs in yourself or a loved one, please reach out to your healthcare provider. They're your best resource for a proper assessment and personalized advice. I genuinely encourage you to reflect on this vital information. What's one thing you learned today that resonated with you, or one sign you might pay closer attention to? Please share your thoughts, your experiences, or any questions you have in the comments below. Your insights are incredibly valuable and can inspire others in our supportive community. If you found this video informative, reassuring, and truly helpful, please give a thumbs up. And if you're new to the channel, I would be deeply honored if you would subscribe for more essential content focused on healthy aging, well-being, and living your best life. Sharing this video could genuinely help someone you care about gain clarity and peace of mind about their cognitive health. Thank you for being here with me today.